Hi everybody, I'm Kelly with HealthyPlace.com, and today we're going to be talking about skin picking disorder, also known as excoriation disorder. And our guests are Laura Barton and therapist Jenna Schaefer. So to start out, you can find Laura on Instagram at Laura_Barton, and you can find Jenna Schaefer at jennaschaefer.therapy. Yes, I'm looking at it right there. Remember, we always welcome your questions and your comments and your stories, and our guests will address those as we go along. So, Laura has written 2 anthologies about skin picking disorder. She also writes about it on her blog called Surviving Mental Health Stigma on HealthyPlace.com. She has lived with the disorder since she was a toddler, but she didn't find out what it was until much, much later. So let me find her. She was just here, just a minute ago. Let's see. All right. I just messaged her a minute ago, so I'm not quite sure where she is right now. Great. Does anybody out there have a skin picking disorder, or do you know somebody who does? Let's see. What if I brought Jenna on first, and we can bring Laura on when she gets back over here. So Jenna, let me ask you. Hi Jenna, thank you for being here. I didn't get a chance.
Having me.
I didn't think to introduce you before you came on, but you're working in an inpatient program right now for OCD spectrum disorders and anxiety and eating disorders, right?
Yes, yes.
Okay.
I solely used to work with just OCD and anxiety for about 5 years.
Mm-hmm.
And now I work with eating disorder primary diagnosis. And a lot of our patients do also have a lot of comorbidities with anxiety and OCD
Okay.
as well. We still definitely get a heavy dose of that too.
Well, I hate to do this to you, but I just see that Laura joined.
Yeah.
So I'll bring her on and we'll talk about her story and then give you a chance to talk about that too.
Sounds good.
Okay, see you in a minute. Let's see. Here we go. So to remind everybody, Laura's been living with this since she was a toddler, but she didn't really know anything about it until she was quite a bit older. So let's go. She's connecting. I can see the little circle going. I just can't see her. Can any of you see her yet? Let me send her another invite. Maybe that'll do it. Let me try again, Laura. Oops, I just waved at you. Well, my connection is good, so that's not the problem. All right. Let's try this one more time. All right, so I think I'm seeing people who are... Hi, Laura.
Hi, there we go. Some technical difficulties.
We got you, though.
Yeah,
and I already see here that a couple people have said, a couple people in the audience, I believe, were answering my question, if they live with skin picking disorder. So I'll just acknowledge them real quick. We've got Samrad and J. Blow Higgs, I think. maybe. But it's good to have you guys here and everybody else too. So, Laura, when when did this disorder start for you?
So for me, it started when I was a toddler. So I was really young. Don't really have an exact age, but in talking with my mom, we figure it was around like 5 years old is kind of when I started. So
At that young age, did you know that something was wrong with the behavior? I hate to say wrong when we talk about mental health, but I guess not average about the way you picked at your skin. At that age, did you know that something was off?
so really, I kind of only knew because other people pointed it out. It's one of those things where you don't really know it's a problem until someone tells you it's a problem.
Mm-hmm.
At least at that age, that's how it was for me, just because to me it was just a normal thing that I did.
Mm-hmm.
But through family members and just different people saying like, oh, well, why are you doing that? Or you shouldn't be doing that. That's when it, you know, alerted to me like, oh, maybe I shouldn't be doing this. And like what I'm doing is not good. So,
Well, what did your parents do when they noticed it?
so a lot of it was them just trying to get me to stop doing it in various ways. From a parent's perspective, I can understand these days that like how they approached it, because it was in ways like, oh, you shouldn't be doing that, or you need to stop picking your skin, or that's going to leave scars, it's going to damage your skin, things like that. And it
Mm-hmm.
was just in an effort to obviously get the behavior to stop because they were concerned about it. They
Mm-hmm.
didn't really know how to approach it, so that was the way they went with trying to get it to stop.
Yeah, they took you to the doctor also, right? And what did the doctor do?
Yeah, so my mom took me to the doctor when I was young. I don't remember how old,
Mm-hmm.
but I have this memory of sitting in the doctor's office, and he was asking me, like, he was a super nice doctor, the nicest man, and he was asking me, well, why do you pick your skin? And because of, that sense of I was doing something wrong, and I felt worried about, like, how I would maybe get in trouble for it or something like that, I just flat out said, like, I don't. So it
Mm-hmm.
was a lie, obviously, but that's how I approached it then, just because I didn't want to get in trouble. And I just felt that shame already, even at a young age. So.
Yeah, I was going to ask you about that next, about feeling that shame because your parents, in telling you, stop doing that, they're giving you the idea that, you're bad for doing it. And then even the well-intentioned doctor, when he asked, why are you doing this? It's kind of a judgmental type question right there. So how did that shame affect you when you were really young and maybe in high school also?
Yeah, so you're right. Like that, it's well intentioned the way that they were approaching it, but it did result in feeling that shame. And for the longest time, I just didn't talk about having skin picking, and I tried to hide it, even from my parents who knew that I did it. I was trying to hide it so that they wouldn't know how bad it was, or how frequently I was picking, or the damage that I was doing.
Mm-hmm.
And so it really created this sense of isolation, and I felt like I had to deal with it with myself, because again, I didn't want to have people shaming me, or feel like when I was younger, like getting in trouble or whatever the case was. So it was just a really isolating experience for the longest time.
Now, when in high school, when we're all so vulnerable,
Mm-hmm.
to critique or anything, did you try to hide it from anybody, or did you talk about anything like it to your friends? I mean, or was it just completely kept, quiet?
So yes and no to trying to hide it. I never wore makeup or anything. That's just never been my thing, really.
Mm-hmm.
And I was a big face picker during high school, just because of acne and things like that. So that was very difficult to hide. And I remember instances where even one classmate at one point said, well, did you just come back from having the chicken pox or something? Because, it's sort of that same, I guess, kind of visual. But I did try to hide it however I could with like wearing long sleeve shirts or long pants. Even if it was really hot outside, I would have some sort of long sleeves on or long pants just to make sure that no one could see the picking marks and scars on my arms, just because I still didn't talk about it then, even with my friends. My friends, I never mentioned it to them. Some of them have messaged me since saying that they had no idea that I was dealing with that, and that, you know, is just like I said, not something I spoke about at all, because I didn't want to lose my friends. That was another thing. Like, I was afraid that this disorder made me so unlikable or like a bad person or something, that I would lose my friends and not have those connections with my peers.
So it's really kind of scary to have to, you know, live in that way. So did you develop any like other disorders? Do you, or did you have depression, anxiety, or some other OCD related issue?
So I don't have any sort of obsessive compulsive related issues that I'm aware of. I have dealt with depression and anxiety throughout my life. I don't think they're necessarily linked to the skin picking, as like the skin picking caused those things. Social anxiety is something that I've dealt with since I was very, very young as well. It was always just kind of passed off as I was a really shy kid. But as I grew up and started learning about it, then it made more sense that, you know, it wasn't just that. But I mean, the skin picking definitely did factor into those things, because it increased the anxiety and it increased the depression, because of that fear of being found out, I guess, and trying to deal with the disorder alone. So it's definitely all linked together in many ways. But I don't know that one really caused the other, if you know what I mean.
Yes, I can understand that.
Yeah.
What you described, you know, wearing long pants and long sleeves, even when it's super hot outside, it sounds like the same thing that people who self-harm will do. So to you, what's the difference between the skin picking and self-harm?
Yeah, so that's a good question to ask, and often a topic when it comes to skin picking, even within the conversations and community of those that deal with skin picking disorder. Because ultimately, picking the skin does harm the skin. It leaves wounds, it leaves scars if you pick enough. And so it can seem like self-harm in that way, but in this case, skin picking disorder is not self-harm, because the intention isn't to harm oneself when you're doing this. The harm is a byproduct of the behavior rather than the intention of the behavior. And when I talk about skin picking and self-harm as well, one thing I like to emphasize is that I'm not trying to say that self-harm is bad or one is better than the other. You know, it's just a matter of recognizing that they're different. So because you wouldn't necessarily treat them the same way.
Okay. So tell me about when you discovered you had this disorder.
Sure. So for the longest time, obviously, I knew I was picking my skin, didn't really know why or have a name for it. I just thought that, you know, I did this thing and I couldn't control it. The first time I really looked into it and looked it up was in high school. I was around like 16 or so. I did a web search online, just, you know, what's going on with me? Why do I pick my skin? And I found this website that explained skin picking. I think it called it chronic skin picking on that website. And what I found there wasn't very comforting or anything. Like, it was probably just factual. Like, I don't think it was intending to be shameful or make anyone feel bad. It was just my reception of it was not that great. So I deleted my search history, kind of felt worse about myself for it, and didn't touch it again for a few years until it's probably 19 or 20. And that's when I started looking into it again and received the information better, I guess you could say.
So you found out basically on your own. Have you ever sought help or treatment for it?
I have not. No, there have been many times where I thought about it, especially around that late teens, early 20s time when I was really struggling with it. But I didn't really know how to go about it even. It's kind of one of those disorders that not many people know about. And again, at that time I was dealing with a lot of shame with it as well still. So it was hard to even think about making that call to schedule an appointment or tell anybody about it. So at that time I didn't seek any sort of help, even though I was kind of looking around to see what might be out there. And then just kind of through learning about the disorder and becoming more comfortable in my own skin, I got to the point where I don't feel like I need to seek help for it anymore. And that's just where I'm at in my life. It's not them trying to shame the therapy or say that people shouldn't get help for this, but that's just my experience with it right now. Is I'm okay with it and I don't really feel I need to go that avenue.
So would you say that you're in recovery?
I would say that I'm in recovery, yeah. It's another interesting topic in the skin picking conversation and with other skin pickers, is because a lot of people equate recovery with having stopped entirely and, you know, being cured of the disorder, which I'm not at all. I still pick my skin every day and have, you know, days where it's worse than others. And so by that standard, I'm not recovered because I'm not cured and I'm still engaging in the behavior. But for me, I consider myself recovered because I'm at a much better place mentally with the disorder. It doesn't negatively impact me emotionally anymore. I don't feel that shame anymore. I don't feel like I have to hide anymore. I can talk about having the disorder and be honest about my experience with it, to not only, I guess, try to educate others, but to let other people know that they're not alone with this disorder. And that's something I never thought I would ever do. Even a few years ago, it was just kind of mind-blowing to think that I would talk about the disorder at all. So to me, yes, I feel like I'm recovered just because of that, you know, mental piece with it.
So I mentioned earlier that you had written 2 anthologies about it. Were you comfortable when you started writing your first anthology, or was that process kind of something that helped you get comfortable?
It was kind of part of that process that helped me get comfortable. Part of the reason I wanted to write the anthology initially was because I did want to tell my story, but I wasn't confident enough to go at it by myself. So I kind of posed this idea in one of the Facebook groups I'm in, saying like, hey, would anyone else be interested in, you know, joining me on this journey and going about telling our stories? And yeah, then it just kind of went from there, like through reading other people's stories and communicating with them. It was like a snowball effect. When you find that community and you find that place to belong, it helps you feel better about yourself as well, and then you can just move forward with it. So
well, do you have, it sounds like maybe connecting with other people, kind of coming out of your shell, your shame, and, you know, connecting with others is a good idea. Are there any certain websites that you would recommend, or any idea of where people should go to get started?
for sure. I mean, there are a few organizations that you can look into that touch on skin picking disorder and others like it. I'm a part of an organization here in Canada called the Canadian BFRB Support Network. We offer information and resources for people with these disorders. In the US, there's an organization called the TLC Foundation for BFRBs. It's a similar sort of organization offering resources, and they also have a like research arm, so they're really partnering with like different doctors and scientists and stuff to look more into the medical side of these disorders. And another organization that you can look into is called the Picking Me Foundation. That was started by a skin picker, and again, just kind of raising awareness about the disorder, giving people a place where they could feel like they belong and have somewhere to express themselves. And each of those has kind of their own little support groups. And if you're interested in online sort of support groups, the place I started with connecting with the community was on Facebook. There are a bunch of different Facebook support groups that are private, so you don't have to worry about, you know, your friends and family seeing anything you're posting there. And it's just a great place to connect with others and learn about these things.
Well, do you have anything else you would like to say about your experience?
Just, I guess that it's been a long road, and that's okay. It's not an overnight process to become comfortable in your own skin, especially when you're dealing with something like skin picking disorder. So if you feel like you're kind of trudging along and you're maybe not where you want to be, that's okay. Celebrate any small victories that come along the way, and just keep trying. You'll get to a place, I believe, eventually where you feel more comfortable with the disorder and with yourself overall. So don't give up. There is hope out there.
Well, Laura, thank you so much for coming on and talking about this. I'm sure you've helped a lot of people today and in the future when they watch this again. So I appreciate your time and your story. So thank you.
Yeah, thank you so much for having me. It's been great.
I'll talk to you later.
Yeah.
Let's see. Now I don't see an X. Oh, there we go. Okay. Cool. All right. Well, we saw Jenna just a few minutes ago, our therapist for today. So let me invite her back. Send request. And Jenna has worked with OCD-related disorders for a long time. So I'm interested to pick your brain about this. And before I go on, just let me say, share your thoughts and your questions in the chat box, and Jenna can help us answer them. I'm sorry, I just had a brain blank because I'm supposed to be introducing you right now, but I will just go ahead and start. What did you think about Laura's story?
That was incredibly awesome and brave. It's hard to talk about things related to mental health. It is very, very challenging. And anyone that is able to do that that was incredibly awesome to watch and see. And definitely, I think as much as I enjoy sharing my information and expertise with other people in order to help them, I think that when it does come from someone who's actually experienced the condition, it is so powerful. You're getting a front row seat and insight into what exactly it's like to live with it. It's more powerful than anything I could ever say. So that was awesome.
So this is a disorder that kind of falls under obsessive-compulsive disorder. Am I saying that right?
Yes, it's an OCD-related spectrum disorder. So it's kind of in that family. Skin picking in and of itself, we call it a body-focused repetitive behavior. There's a few of them. Another one that's really common that a lot of people know about or have heard about is like hair pulling, or something we call trichotillomania. Excessive nail biting can kind of fall into that category. So skin picking is in that category. And yes, it is an OCD spectrum disorder. Is it in a way that it is a compulsive behavior? You don't need to have OCD, like Laura said, to have skin picking. Mm-hmm. It can exist on its own. It does occur a lot with OCD. It doesn't have to.
Okay. What I asked Laura to kind of go through, is self-harm and skin picking, are those the same thing? But I want to kind of get that from your perspective too, and some people also mention it being related to addiction. So, have you heard that, and what are the differences?
I don't know if I would say addiction as much as I would say maybe habit or habitual. To me, that those words are different. Mm-hmm. I think there is relief that is gained when skin picking that will reinforce that behavior. With the self-harm piece, I think she was spot on really with her explanation of that, as far as that they are incredibly different. They are often very confused. Sometimes people do scratch at their skin and pick to self-harm,
Mm-hmm.
but when it's skin picking disorder, it is not based in self-harm, as the person is not intentionally trying to hurt themselves.
Okay.
Usually with skin picking, we're seeing more of a relief in stress or anxiety, than we are unintentionally wanting to harm yourself.
I saw something the other day. This lady was talking about her skin picking on her face, and she said, she would catch it too late, where she had already opened a sore, or, there was already an infection there. And is there anything someone can do when they're going through this? Is there a way to notice it sooner? I don't really even know how to ask that. Is there a way to prevent it?
A way to prevent it. That's an interesting question. I think the best thing that you can do if you're noticing that the skin picking is becoming somewhat of, this is consistently happening, notice myself doing this more and more, I think is to start to kind of identify what's happening in your environment that might be leading up to wanting to pick your skin, like the triggers.
Mm-hmm.
How are you feeling? What are particular thoughts that you're having? What are you noticing about yourself and environment, in order to kind of maybe catch it a little bit before it happens, or to kind of know when it's going to happen? A lot of times, though, that is very common, where I've had people tell me, like, I'm just putting my makeup on, and all of a sudden, next thing I notice, I'm picking my skin, and it really was kind of more of a subconscious event. And in those instances, some things that can be helpful to putting tape over your fingertips when you're doing anything around your face, making sure your nails are filed very short, wearing gloves,
Mm-hmm.
things like that, things that prevent a barrier between your fingers and your skin. Obviously, support is essential for basically every mental health condition that there is. So if there is someone that you live with, that you trust, that knows what's going on, maybe having someone with you can be helpful.
Mm-hmm.
To not engage as much in the behavior.
Laura, let's think a minute about our kids, and when we notice it in our teens or our children. And Laura's parents said, stop doing that. Don't do that. And they were well-intentioned, but it made her feel very ashamed. So is there something we can do for our kids instead of, making them feel bad about it?
Yes, I think open communication, talking to them about it, in a non-directive way, more of a strength-based way. Be like, you can approach your children. I've noticed that, you're picking at your feet a lot, or your face, can you want to talk about that with me? What should I know? How can I help support you? And it depends on the child's age. Obviously, when it starts when they're very young, it's a little bit harder to do this. And I would definitely encourage opening dialogue with a pediatrician or a child therapist at that point about what you're noticing. But I think that open communication, it's not, you can't just stop doing it. No matter how many times someone is going to be, just stop doing that, just don't do that. It's not going to happen. A lot of the times, it's just done subconsciously.
Mm-hmm.
They're just sitting there, and it begins happening. It's not something that they're really actively thinking about doing, and they just notice themselves doing it.
So when you notice that they're not trying to defy you or anything by whatever, you just kind of need to get them to the doctor and start the process of treatment, right?
Yes, and I think the earlier the interventions can occur, the better the outcome can be. I agree with everything Laura said as far as recovery versus cured. I don't like using the word cured either. I don't like using the word cured really with any mental health condition. Managed is a good word. Treated is a good word. As far as complete absence of this behavior occurring, I'm not saying that it's not impossible, and I'm sure there's been times that has happened for some people. I don't believe it's the majority. Mm-hmm. I think that it can definitely be less than what it could could do two things. It could either stop the severity of it by getting treatment, so it getting worse, and then it can be lessened. One of the things that we do when we approach skin picking, when we use cognitive behavioral therapy, is that we do something kind of called habit reversal, where we start to introduce something else, usually involving the hands when it comes to picking, that a child or someone that has a disorder can do, like a stress ball, for example. Or sometimes people really like enjoy crafting or painting, things they can do with their hands when they're starting to feel urges to want to pick at their skin. So having a stress ball or a fidget or something nearby can be really helpful too.
Did you say that was habit reversal? Is that what you said?
Yes, that's kind of the jargon name for it. But replacing it with something else, yes.
Okay. Help people who like to Google stuff, you know. Do you have anything that you think we should touch on that we haven't at this point?
Just, I guess I would just like to, this can be a very, very serious condition. I think that sometimes people think that it isn't, you know, they kind of, you know, I've seen it to the point where there's been permanent deformities, you know, to someone's face due to picking at the skin. And I think it is definitely a disorder that doesn't really have, there isn't a lot of knowledge out there about it, but it can have very devastating consequences without support and without treatment and without education about it. So, I mean, if you are noticing, if you do have children or you're noticing that you're doing this yourself, I definitely would encourage you to seek therapy. There are ways that it can be better managed so it doesn't become more or worse.
Well, I thank you so much for being on with us today, Jenna, and I hope to bring you on again sometime. So I appreciate it very much.
Thank you so much for having me. Thank you so much, Laura, for sharing your story. If you're still watching, that was awesome to see. And yeah, love to come back on.
All right. Well, I will talk to you later then. Thank you again.
All right. Thank you. Bye.
Bye. There we go. Okay, everybody. Oh, boo, bear in me. I'm sorry. You've picked to the point of infection. I'm sorry it's gotten that bad for you. I'm sorry I didn't see that when she was still on, but I want to thank everybody for being here today, and I hope it's been beneficial for you. You can go to HealthyPlace.com, and there is information about skin picking under the obsessive-compulsive disorder tab. You can also learn about all kinds of other mental health conditions there too. So I will be back again in 2 weeks with another Instagram Live, and thank you so much for being here today.